just through here. Just come through.
Physiotherapy was one of the areas that we felt we could do some work on that would release the pressure point for GPs and other practice staff.
Last summer, Gloucestershire Care Services were invited into a GP cluster locality board meeting. There was an acknowledgement within some of the practices that quite a lot of their work within primary care had a musculoskeletal element. Several of the GPs expressed an interest in some of the models that they'd heard about developing nationally. So they knew that physiotherapists, advanced practitioner physiotherapists, were starting to actually work out in primary care, and actually working with Gloucestershire Care Services as a host provider could give some more governance assurance as a pilot model.
It was felt that actually by looking at doing something with their MSK services locally, we could help support giving the patients a better pathway through that service. It would also mean that we could actually tap in as a cluster the expertise and knowledge that the APPs have, so that they could then filter that down within the practice team. So actually we felt it was a benefit for both the patients but also the existing clinical teams in place. What we've contracted is a 52-week service. We have the advanced physiotherapist practitioners working daily across the 5 practices. We're lucky enough to be in one building, so they stay in the same building, but they work in each practice on a daily basis.
So you say you're in pain this morning.
A triage pro forma has been put together, which receptionists would ask as part of care navigation. They then have access to a global appointment book, which they can book in both emergencies on the day and up to a week or 2 weeks in advance.
The benefits to the primary care team or the practice will be that they know that the physiotherapists, the advanced physiotherapists that they are employing, their competencies they know will be assured. Another advantage that we've found about having the clinicians working in a host provider model is that they are maintaining their knowledge of the musculoskeletal clinical pathways. It is very helpful to have the clinicians working not only within our organisation so that they are kept up to date with any changes and developments, but also then actually translating and taking those clinical pathway changes out into primary care. So there's a benefit from both sides.
Do you want to come and stand up for me?
Some of the challenges that we had early on when we set the model up were really around individual perceptions of what the role was.
Okay.
GPs perhaps felt they lost a little bit of control, and actually what happened was that they sort of got involved in perhaps that patient needs to come to me first, then I'll refer them on, which actually defeated the object of the service. The object of the service was to provide those patients with a much more clear and appropriate pathway.
And how are those movements?
But actually, as patients came back and said very good things, it was very successful, they saw the reduction in their workload. That's when that sort of scepticism and concern sort of withered away.
And push against me, just lift it up, good.
In the model that we put together, we found that actually we have a very good shared learning environment. They're actually hosted by us, so they're here every day. So they actually get to have coffee breaks with staff, they get to have lunch break with staff, they're walking in the corridor, they're working alongside people, they actually go in and talk to people, they can go into reception, they can go into a GP. And what we found is we're actually informal learning is as valuable as formal learning.
So we've had a little look at your elbow.
What we do know through patient questionnaires is that they've all loved the service, so that's been fantastic.
If you're happy to have some physical...
And the fact that actually as an individual, if you can see somebody at an earlier stage for your condition and have access to assessment, you're probably not really likely to need to go in for a specialist treatment within a hospital setting. So you don't have that delayed time for where you go between the primary care setting into a secondary care setting.
The cluster pilots that we're running at the moment, I think, have been a fantastic opportunity for us to really build up closer relationships and closer working with primary care. There's a real role within community organisations and community services to work more collaboratively, and we found that the clinical pathway for patients, the benefit for patients, is significant when you actually work collectively, collaboratively.